All right, let's talk about artificial intelligence. We all know it's set to completely change healthcare as we know it, but the big question is, how ready are we really? Today, we're doing a full health check on Europe's readiness for this AI revolution, and we're using a major new report from the World Health Organization as our guide. So let's dive in and see what the report card actually says.
So this is the central question, right? It's the one driving billions in investment and so much research. Could AI really transform our health? The promise is, well, huge. But getting there, that's the tricky part. So, what's all the excitement about? It pretty much boils down to three massive game changers. First, the potential to just make us healthier. Better diagnoses, more personalized treatments. Second, taking some of the immense pressure off our doctors and nurses. And third, making the whole healthcare system run smarter and more efficiently. The stakes, honestly, couldn't be higher.
Okay, so first stop on our health check, the plan. What's the actual blueprint that countries are putting together to handle this massive shift in technology?
And right out of the gate, we hit a really surprising number. Despite all the hype and all the talk, only 8%, just 8, of European countries have a dedicated national strategy specifically for AI and healthcare. This shows a huge gap between ambition and actual concrete action. It seems like everyone's talking about AI, but very few have a clear map for how to get there.
Now, for the countries that do have a plan, they're basically choosing between two different paths. On one hand, you can create a super focused health-specific strategy. The big plus, you can move really fast. The downside, you might end up with a patchwork of different standards. The other option is a big cross-sector strategy that covers everything. That gives you consistency for sure, but the unique, complex needs of healthcare can kind of get lost in the shuffle. It's like, do you build a specialized surgical wing really fast, or do you redesign the whole hospital from the ground up? One is quick and targeted, the other is slower but way more integrated.
But a blueprint is just paper. The real question is about the people. Who is actually at the table helping to build this new future? And maybe more importantly, who's being left out?
This is where it gets really interesting. This chart tells a story about who has a voice. You can see government officials, healthcare providers, and the AI developers themselves are all heavily involved. But just look at the bottom. Patient groups and the general public are barely represented. And why does that matter so much? Well, if you don't include them, you risk creating these technically amazing tools that nobody actually trusts or that don't solve the problems real people have.
And it's not just about the patients. What about the people on the front lines? This slide points to another huge problem: preparation. Only about a quarter of countries are offering any kind of AI training to their current health professionals. Think about that. It's like we're handing them this incredibly powerful, revolutionary new piece of equipment, but forgetting to include the instruction manual.
Okay, so this brings us to probably the most complicated part of our health check: the rules of the road. What are the legal guardrails and the real-world roadblocks that are holding back the safe adoption of AI?
So when you ask countries, hey, what's holding you back? The answers are, well, they're loud and clear. Of course, money is a big issue, no surprise there. But the single biggest barrier, we're talking a massive 86% of countries, is legal uncertainty. Just think about it for a second. If an AI makes a wrong diagnosis, who's on the hook? The doctor? The hospital? The company that wrote the code? If nobody knows the answer, everyone's too scared to move forward.
So, if legal confusion is the #1 roadblock, what's the green light everyone's waiting for? Well, this slide spells it out. An overwhelming 92% of countries agree the key is having clear rules about liability. We absolutely have to know who is responsible when something goes wrong. Until that's crystal clear, all this amazing progress is just going to be stuck in legal limbo.
But here's the thing. Even if you have perfect plans, engaged people, and clear rules, all of it, and I mean all of it, can fall apart without one critical ingredient: data you can trust. This quote from the WHO report really nails it. If you don't have a strong foundation of data governance, you're just going to end up with fancy AI tools that don't actually work in the real world.
So how do we build that foundation of trust? The report actually lays out a pretty clear 4-step process. It all starts with a national strategy. That's the master plan. Then you build secure data hubs. Think of them like a digital Fort Knox for our health information. Next, you set up really clear rules for sharing that data so we can use it for research without compromising anyone's privacy. And notice that last step. It brings us right back to what we talked about earlier, making sure the public and patients are involved every single step of the way. It's a full circle of strategy, security, sharing, and society.
So we've checked the plans, we've checked in on the people, and we've looked at the rules.
After this whole checkup, what's the final prognosis for AI in European healthcare?
You know, the technology is here. The potential is absolutely undeniable. AI is ready to get to work in our hospitals and clinics. So the ultimate question this report leaves us with isn't really about the technology at all. It's about us. Are our plans, our people, and our rules truly ready for what's coming next